We're so grateful to have you here. Dr. Kim is joining us today. She's a cornea specialist, ophthalmologist, who's going to talk to us today about dry eye. It's a really common complaint that I get from patients. A lot of times they want to know what they can do and what causes it. So, welcome, Dr. Kim. We're so glad you joined us today.
Sure, thanks for having me.
Yeah. So, can you talk a little bit to that? Do you get that complaint a lot from patients, or is it just me?
Sure, yeah, very, very common. Typically you'll hear about burning, irritation, redness. More subtly, patients may complain about blurry vision, light sensitivity, tearing, even stringy mucus in their eyes. Those can all be symptoms of dry eye.
Okay. And then in terms of like how you diagnose dry eye and what some treatments might be that you would recommend, can you go into that?
Sure. So, nothing beats a good clinical exam. Um, and it really is important to figure out what type of dry eye you have. So the tear film itself has 3 different layers. So each one of those 3 layers, if one layer is dysfunctional, you can develop dry eye. So it's really important for your doctor to be able to distinguish which layers are dysfunctional and then target treatment based on that layer. You'll hear tons of different treatment modalities, over the counter drops, prescription eye drops, nasal sprays, creams, prescription oral medication, procedures, insurance, procedures that are covered by insurance, procedures that are not covered by insurance. And some of them may be beneficial, but again, it really depends on the type of dry eye that you have and being able to target that layer of tear film deficiency.
Interesting. I skipped through what were the causes typically of dry eye, and I didn't realize there were three tear film layers. So, yeah, can you talk a little bit more about that?
Yeah, sure. So, you know, um, the 3 different layers, each layer is produced by a different part of your eye. And so, depending on which layer is deficient, that can contribute to dry eye. There are so many risk factors that can cause and contribute to dry eye. That ranges from age, gender, medication use, medical conditions, history of contact lens wear, history of refractive surgery. That includes, LASIK, PRK, SMILE, even things like screen time, facial creams, allergies. There are just so many things that can contribute to dry eye.
Yeah. Okay. So, for patients who maybe have some of those risk factors, let's say screen time and some facial products that they're using, what would you kind of recommend in those cases?
Sure. So I always like with my patients, I always like to do a good baseline exam and then to kind of go through any risk factors they may have. For women, especially, one thing people don't realize is that retinol is very drying and it's kind of made its way into mainstream anti aging products. And even though you're just using it on your face, it absolutely can have an effect on your eyes and very commonly can exacerbate dry eye. In terms of screen time, studies have shown that we are so when we're focused on so much near work, we don't blink as frequently or as fully. So, we're seeing a lot more dry eye occur even in young kids now. And generally, we try to encourage people. There's a 20-20-20 rule. So, every 20 minutes of screen time, look at something 20 feet away for about 20 seconds and then kind of resume your activity.
Oh, wow. That's great. And so, for the retinol, I did not know that. And so, that is really interesting. I wonder if you see that and then what you do if the person is continuing to use retinol, like is that, or do you just remove it, basically remove the underlying factor, or is there a topical treatment? You mentioned some topical treatments, so you talked about creams, gels, drops. Obviously, what sort of treatments are there for dry eye?
Sure. So, for people who are on retinol, depending on how severe their symptoms are, we'll try to taper it or to at least decrease the amount of usage. And we just want to find, a balance. You got to live your life. And so I never tell people they have to stop it completely. But if it's really severe, sometimes we'll stop it for a period of time and kind of get better control of their dryness, and then slowly introduce it back into their system. In patients who have a clogging of their meibomian glands, which produce oils that make up the outermost layer of your tear surface, these glands, when they get damaged, we can't get them back. So, I really try to emphasize treatment for that. That usually starts with just doing some warm compresses, opening up your glands, getting those healthy oils flowing to help kind of protect the tears on your surface a little better.
Yeah. Wow. That's great. Thanks. Yeah. So at what point would you recommend if someone's having symptoms of just, let's say, dry eyes, not necessarily irritated red or like burning or vision changes, like at what point should they seek care from a specialist?
I don't think it ever hurts to get a baseline exam, especially if they have any risk factors mentioned before. People usually understand the analogy of a dentist. So even if you might not be having tooth pain, you still are recommended to brush your teeth every day, because that over time, without doing that, you can develop more permanent damage to your teeth. So actually, it's very similar to your eyes. Even before you have symptoms, we can often see signs of dry eye. And if we can kind of get ahead of that and kind of help give you some tools to maintain good health, that's always the goal. So especially if you've had a history of LASIK or contact lens wear, or you're having any of the symptoms or any of the risk factors, it doesn't hurt to get that baseline exam to see if there's anything we can maybe optimize and give you some tools to better maintain the surface of your eye.
Yeah. So a lot of people wear contacts. And I have some sense that there's oxygen rich contacts or contacts that allow more oxygen to get to your eye. And there's others that don't. So I just wonder, is that related to dry eye? Is that what you would recommend for a contact wearer or would you just recommend less time with their contacts? How do you go about changing that?
Yeah, I think technology for contact lens has improved significantly, and a lot of the brands do provide really excellent oxygen diffusion products. Regardless, yeah, oftentimes I find that it is more about wear time and the chronicity. So even with my contact lens wearers, if they are showing signs of dry eye, I will always encourage them to try to limit the amount of time they're wearing their contacts regardless. And if they're wearing multi-use contact lenses, to make sure they're cleaning them really thoroughly with kind of one of those peroxide-based cleaning solutions. That's going to do the best to really remove all the debris from the contact lens. And then, yeah, and kind of just going from there.
Yeah, great. And then one more question, I guess, about women and perimenopause and whether hormones and lack thereof affect dry eye and if it's more common in women.
Yes, absolutely. So we do know, and studies have shown that dry eye does tend to be more commonly seen in women, and we do believe there is a hormonal aspect as well. So women who are perimenopausal, who are menopausal, and in addition to certain medications they may be taking, we really want to take note of that and be able to kind of be more aggressive knowing that they have additional risk factors.
Yeah, no, that's great. Thank you so much. This has been super insightful. I really appreciate you taking the time out of your day to join us. Can you let people know, because I know we refer all the time to you and you're in Displays, but that's about all I know. So remind me where people can reach out to you if they're looking for an ophthalmologist.
Sure. Yeah. This is really fun. I feel like we could talk about dry eye all day just because it's so common, but yet so complex. I don't consider myself a dry eye specialist per se, but because I am a cornea specialist, we do have more training in looking at very subtle signs on the cornea, and that just tends to translate into more, severe cases of dry eye and things like that. My practice is in Displays, and our phone number is 224-725-3239. If anyone wants to make an appointment, happy to talk about dry eye or anything cornea related or even comprehensive related anytime.
Thank you so much. We really appreciate you having your time today.
Thanks for having me.